Welcome to the Ueno Center. This video will review the home care required after your surgical procedure. These instructions will also be given the day of your surgery. It is important not to disrupt the surgery site. Please refrain from sticking your fingers in your mouth and try to keep your tongue away from the surgery site. The stitches that we use are dissolvable, but can take 1 to 4 weeks to dissolve on their own. You may have some bleeding and spotting for the first 24 hours. Take a piece of gauze, fold it into fours, get it a little damp, place it in the surgery site, and bite down to apply pressure, as this will help stop the bleeding. Continue brushing all other teeth like normal. You will be provided an extra soft post-op toothbrush that you will use in the area of the surgery and the gums. You will also receive a mouth rinse that you will use as prescribed. Please refrain from any forceful or aggressive rinsing for the first few days. You may experience swelling and bruising after your surgery. It is important that you ice 20 minutes on, 20 minutes off for the first 3 days, as the peak swelling occurs at 72 hours. Keep your head elevated with an extra pillow to help reduce swelling. You may receive prescriptions for antibiotics, anti-inflammatories, and a pain reliever. You should start your antibiotic 2 days before your procedure and finish out the duration as prescribed. The anti-inflammatory is typically an ibuprofen, which is good for both pain and for swelling. We do recommend that you take the ibuprofen for the first 3 days as prescribed to help reduce inflammation and discomfort that you may have. The additional pain reliever is typically a narcotic, which is good for your comfort. You don't have to take it unless you need it. You will need to rest for the first 3 to 5 days following your surgery. We recommend no heavy lifting or vigorous exercising. We don't want your heart rate to get elevated because that can cause bleeding and slow healing down. Please refrain from smoking, vaping, or using alcohol while your surgery site is healing and while you are on prescriptions. They can have an adverse reaction. You will be on a soft food diet for 1 week. The first 24 hours will be cold to room temperature mushy foods. After the first 24 hours, you can slowly warm things back up. Avoid anything too hard or crunchy because this can cause trauma to the site. Do not use straws for the first week as this can disrupt the healing. If you have any questions or concerns, feel free to give us a call at the office and we look forward to seeing you for your procedure.